A really warm welcome, everyone, and thank you for joining North Lincolnshire CCG's annual general meeting. My name's Faisal Baig. I'm a North Lincolnshire GP, and I have the immense privilege of being chair of this organisation. So the AGM is virtual today because of the coronavirus pandemic, and we've already had a few IT hiccups, so I do apologise for anyone who has any issues with the IT, but the AGM will be available to play through Facebook and YouTube later on down the line also. So one of the best parts of the AGM really is that direct conversation with our public, and unfortunately we're not able to do that this time, but we have had a few questions submitted in advance, and there's always the opportunity to submit questions later on. I'd like to say a big thank you to Mark Williams, Sophie Lidbetter and John Mitchell and all of the CCG team who've played a real key role in helping us set up the AGM today. Thank you. We have apologies from Emma Latimer, who's our accountable officer. Emma is now also the accountable officer of two other CCGs, Hull and East Riding, and unfortunately she could only get allocated leave during this time period. So she's asked me to say a big thank you to everyone in the local NHS who's playing such a strong role in helping us deal with the coronavirus pandemic. And she's asked me to thank everyone who supported the organisation over the year. I'd also like to thank Emma for her senior leadership and really helping us take this organisation forward over the last few years. So, in terms of today, we'll just get the slide up for you there, bear with me. Over the next hour and a half to 2 hours, the purpose of the AGM is really to spend some time reflecting on the previous year, our achievements, our challenges, looking to the future and taking questions. So I'm going to start by doing a presentation on COVID-19 and an update on the current situation. We're going to hear from Alex Seal, our Chief Operating Officer, who's going to talk about a year in the CCG. Our Chief Finance Officer, Emma Sainer, is going to talk about our financial situation and how we've made some real progress over the last couple of years. Our Medical Director, Dr. Satpal Shekhawat, is going to talk about a really exciting, innovative virtual pulmonary rehab initiative we've led the way on, nationally and internationally. We will then have a question and answer session hosted by our Vice Chair, Erica Stoddart, who's also lay member for governance, and there are also a couple of videos for you to watch. So, I'd like to start by saying a big thank you. What a year. I think it's fair to say it's been the most challenging year in the history of the NHS. I'd like to really start by thanking the public, our patients, because of your patience, because of your understanding, because of your support. It's meant we've saved lots of lives. So thank you so much. You've made lots of sacrifices and we appreciate that. And I appreciate it's still a difficult time and you'll have to carry on making some of those sacrifices. But thank you so much for working with us. To our NHS frontline staff, to our care worker frontline staff, you've been so brave, dedicated, compassionate throughout. Thank you so much. To my CCG team, our governing body, our executive team, our 19-member practices, the whole CCG team, thank you. You've worked ridiculous number of hours every day to keep our health service locally going. So we're indebted to you. Social care, you played such a key role. It's been such a difficult time for social care, but again, you've been so brave and compassionate throughout. And all of our key workers, our carers, our volunteers, I've been asked by colleagues to say a special thank you to teachers because many of us in the NHS were only able to go to work because teachers were looking after our children. And that's at a time where we knew very little about coronavirus right at the beginning. So again, you showed so much bravery and dedication. Thank you. To all of our partner organisations, North Lincolnshire Council, NLAG, RDASH, Safe Care, our GP Federation, General Practice, who's completely changed the way they work during this pandemic and worked so hard, and so many other organisations. I'm sure I've missed people out, but I would really like to thank all of North Lincolnshire for the effort you've made, and to NHS England, and to our government. It's been a really difficult time. We're learning about this virus every day, and we need to carry on supporting the government and following the advice. Thank you. So unfortunately, we've lost many people to coronavirus. Here is just a snapshot of some frontline healthcare workers that we've lost. For every person that we lose, there's a family behind that person, there's loved ones, they're affected forever. So I wonder if we could maybe just take a few seconds and look at those photos and just reflect. Thank you. Thank you. So I'm going to talk a little about coronavirus COVID-19. COVID-19 really first came to light after we started seeing some patients with viral pneumonia and respiratory failure in Wuhan in China, and things quickly escalated from there. We saw our first case of this virus in January 2020 in the UK, in York, and as you can see, the number of infections worldwide, they're over 30 million now, and that's just people who've been tested, so we know there've been a lot more. We've had nearly 1 million deaths, so it's had a significant impact on the whole world as we know it. If we look at a snapshot from the BBC website, for figures up till yesterday, we've had at least over 41,000 deaths in the UK. That's where coronavirus has been recorded on a death certificate within the previous 28 days. We've had over 400,000 confirmed cases. And if we look at the previous 24-hour reporting period, over 6,000 cases confirmed. So the situation is escalating quite dramatically. There's a graph just showing the trend. So as you can see, these are confirmed cases, and we're seeing a huge rise. Recently, the 7-day average is over 4,000 infections per 24 hours. And as you can see, when things escalated previously, they escalated very fast. So this really is a critical point for us. As you can see, the death rates are slowly rising again. And again, there's a potential for this to escalate very quickly because we do know some of the most vulnerable, those with long-term conditions, some of the older population are now starting to get higher infection rates. Hospital admissions, there has been a challenge put to us by some saying we're only picking up more cases because we're testing more. I think this shows that that's not the case. We are seeing more people who are becoming poorly with coronavirus and going into hospital. So that 7-day average is, again, beginning to rise, and we need to be so careful. The R number, that's the number of people that become infected by one person who's infected. Nationally, that stands between 1.1 to 1.4. We know where that's over 1, things can rise very, very quickly, exponentially. And again, so it's a critical time for us. We come under the jurisdiction of northeastern Yorkshire, and our R number is 1.2 to 1.4, so slightly higher than that number. And here are some North Lincolnshire figures from the BBC website. There's slight variation depending on which website you go to, but this shows us that in the last reporting period, 14th to 20th September, we've had 43 cases, and that's 25 cases per 100,000 people amongst the population. That means we're slightly higher than the national average. Unfortunately, we've lost at least 103 people in North Lincolnshire to coronavirus, and we've had around 885 confirmed cases. So I just wanted to start really with a positive slide before I go on to the challenges. There's been a really solid effort in North Lincolnshire. I think we should all feel proud, and there's just some photos there that illustrate some of that response. Things have happened really quickly. Organisations have come together and worked at real pace together. We've broken down so many organisational barriers, blurred boundaries, and really not worried about our organisations. All we've said is we need to do the right thing by our population. And there's some examples there of some superb services that we commissioned sometimes in a matter of days. And previously that would have taken us months or even years. So there's an example there of our COVID isolation clinic in the community, a community response team. The way our hospitals redeployed their staff to free up capacity to deal with the COVID-19 cases, amazing, literally overnight. There's been so much innovation. For example, general practice turned to video consulting overnight almost, and telephone consulting and online consulting as well. There's been so much goodwill, so much kindness. Everyone's really come together. So there have been so many positives that have come out of all of this, and we really need to hold on to all of those positives because they will see us through. As I said, we have huge challenges. We've had challenges throughout. Many of those remain. We need to think about our workforce, especially the frontline workforce. it's a really difficult time. There's been a lot of burnout. There's been a lot of mental health pressure, anxiety, depression is on the rise. And we really need to support all of our workforce, and that's going to be challenging. Each one of us has a role to play in that because we need our workforce to be healthy, to be well, to help look after everyone else. The NHS has published a people's plan, and that's got a really good blueprint in terms of how we address some of these workforce challenges and how we look after our workforce. So we'll be using that going forward. Testing's come up in the media a lot. I think it's fair to say we're testing way more than we were earlier on, and we still need more tests. There is a slight capacity issue, and we're working with the government, we're working locally to help address those challenges, including prioritisation of tests. We're hearing about a condition called long COVID, where some of the symptoms of COVID actually persist for weeks or months afterwards. Some of the tiredness, the headache, the muscle aches and pains, some of the lung symptoms. So like I say, we're learning a lot about that, and it's happening in some of the younger population who were previously fit and well. So it's just really a warning to anyone who thinks that because they're fit, young and well, they don't need to worry about getting COVID. I think we need to be really cautious about that approach. Restoration of services. We already had huge challenges when it came down to our waiting lists in the hospital. People who were waiting to start their treatment within 18 weeks, people who'd been waiting over a year. We had big challenges locally in North Lincolnshire, and those have been exacerbated because of COVID, because we had to deal with the emergency, really. So it's going to be hard work. We're going to need to work together, the public, primary care, secondary care, all of our partners. We really need to come together on this because those challenges will remain for quite some time. We need to carry on supporting social care. It's going to be a difficult time for them as winter comes again. And there is now a blueprint for supporting social care that's come out nationally, and we need to follow that. There's been a big economic impact on people, and we know jobs and employment are a really important wider determinant of health. So we really need to support those people who are struggling. Education, I've mentioned, there was a time where children weren't going to school and missed out on their education, although there was remote teaching that took place for many. But obviously there's been some impact. We're seeing rising anxiety and depression, as I mentioned earlier, and it's so important we support all those people who've been affected by the mental health impact of COVID-19. And then inequalities have really come to light during COVID-19. We know our black and ethnic minority population has been disproportionately affected by COVID-19, whether that be the general population or our workforce. We're still understanding more about the reasons for that. But Public Health England have done a really good review with some tangible actions in there, and that's like a blueprint for us that we need to really follow and support. We've done some good work locally. Our hospital trust, NLAG, was a national leader when it came to workforce assessments for our BME workforce. So we just really need to build on some of that momentum. So there are reasons to be optimistic. Immunity, we talk about antibodies, and we know some people develop antibodies once they've had COVID-19. We're still learning a lot more about whether they are effective antibodies to deal with the virus and how long they'll last. But there is potentially some hope there for us. There's some great work going on in terms of a vaccine. There are hundreds of trials internationally, and the UK, I understand, is coming very close to actually trialling something in the final stages. We do want a vaccine that's going to be safe and effective, so this is going to take some time, and the vaccine will be prioritised for the people who need it most. So it may be the frontline NHS and social care workers get that vaccine first when it does come. So we just need to be realistic about what happens when the vaccine does come. Some great work going on in terms of treatment. There's some superb work on monoclonal antibodies that many of you will have heard about, artificial antibodies. We know dexamethasone is being used to really help some of the most poorly in hospital and is reducing mortality for those people. And in terms of virus mutation, we know viruses change. Things can go either way. Viruses can become more potent, or actually they can diminish in their virulence. So we can only hope. We know the coronavirus has already changed slightly from when it first surfaced. So we can only really hope that it diminishes in terms of its virulence. So there is hope and light at the end of the tunnel. We just need to work together. So for now, where do we stand? There are some rules, as you know, that have recently come out in terms of the Rule of Six published by the government. There has been some guidance in terms of pubs, restaurants and what time they should close, some more guidance on working from home. There are local lockdowns taking place throughout the country. There are a couple of links there on this slide which will hopefully keep you up to date. And the NHS contact tracing app was also released today, and I hope everyone will download that because that will help. But for now, I think there are certain things that are here to stay for quite some time. And we joke about slogans sometimes, but I think hands, face, space is a really good one. So it's just a reminder to everyone, really, please wash your hands regularly and thoroughly. Anyone who wants a lesson, I have to say children have been taught so well at schools. Get your child to teach you or another child to teach you. They are superb at it. Wear your face masks where they're applicable. And the social distancing, so important. And ventilation as well. If you're indoors, try to leave windows open. Try not to sit face to face, but side to side or back to back. And if people have symptoms, a persistent cough, a temperature, or a change in smell or taste, I cannot emphasize enough the need to isolate immediately. That's the whole household. And arrange a test through 119 or by going online, because that will help stop spread of the virus. So important. So please, we need to work together. We have been working together. We just need to carry that on. Be kind to each other. Please support each other. And please carry on protecting each other. So I'll shortly be passing over to our Chief Operating Officer, Alex Seal. I would just like to thank Alex because much of the COVID response, a senior leadership role she's played in our response. She's worked many, many hours every day, tirelessly, and I think we're all indebted to her. So I will be shortly passing over to Alex, who'll talk a bit more about our year in the CCG. Thank you so much.
Thank you. Hello, I'm Alex Seal, Chief Operating Officer for North Lincolnshire CCG, and I'm delighted to be here today to talk about some of our successes and challenges, and also to tell you about the wider system in which we work. But first, I'd like to just start by telling you what clinical commissioning groups are and what they do. Now, clinical commissioning groups were created following the Health and Social Care Act in 2012, and they replaced primary care trusts on the 1st of April 2013. They're clinically led statutory NHS bodies responsible for the planning and commissioning, which means the buying and planning of healthcare in our local area. And they're driven by our local clinicians to support that as well. There are also membership bodies with local GP practices as the members, and they're led by an elected governing body, which is made up of GPs, other clinicians, including a nurse, and a secondary care consultant and lay members. And they help to provide us with that governance to make sure that we make the right decisions for our populations. So what do we do? CCGs are responsible for commissioning healthcare, including mental health services, urgent and emergency care, elective care, which is planned care such as outpatients and when you go into hospital for a procedure or an operation, and also for community services as well. And commissioning is about getting the best possible health outcomes for our local population. So we start by assessing the local needs and priorities for our population and making sure we set the right strategies to make sure we improve the outcomes for our population, and then buy the services on behalf of our population from a range of providers across our local area. We're ultimately accountable to the Secretary of State for Health and Social Care through NHS England. If you're registered with a North Lincolnshire GP, we'll be commissioning most of your healthcare. And our ambition working with our partners is to help local people to live healthier lives and make sure that when people do require health treatment, they receive the best possible standard of care. Our membership consists of 19 local GP practices, and the number of patients registered with our practices is 179,000. Our healthcare system is changing. In January 2019, the NHS long-term plan was published, and this set out a blueprint for world-class services for the NHS. The NHS plan set out how, moving right through the course of people's lives, how we would improve outcomes for them. So how people would start well, how we'd support children, young people and families, how we provide world-class care for people with chronic conditions such as cardiovascular disease, heart problems, diabetes, respiratory problems, and then how we would support people to age well as well. The NHS plan also focuses very much on how we improve people's mental health as well, and that's been a key focus as we've worked through this COVID period as well. The NHS plan also sets out a planning framework in which we need to operate as a CCG, working with our local partners across a wider geography. And we are actually part of a bigger integrated care system of organisations working together. Integrated care systems are about how collaborations of organisations work together to make the best uses of resources for our population. So as well as working in our local place, which I'll talk about shortly, we work very closely with other partners to be able to support that as well. And we work through the system approach to help us to do that as well. Another key focus within the NHS long-term plan was about primary care and how we support that as well. So if we look at our local dentists, opticians, pharmacists and local GPs, how we work really closely to support them. And a big focus was around how we work with our local GPs so that they can collaborate together effectively through primary care networks to deliver a wider range of services. As well as all of our statutory and non-for-profit organisations, we also work really closely with our partners in the local authority and also a whole range of voluntary and community sector organisations that are critical to making sure that we support people to achieve the best outcomes. So we are now part of the Humber Coast and Vale integrated healthcare system, which is that wider geography. But what does integrated care mean? It's very much about how we move away from individual organisations to work together to achieve the best outcomes for people within our population. And at an individual level, how do we achieve that really good coordinated care that's wrapped around the individual and supports their holistic needs? Within our integrated care system, we have also established the Humber Partnership. And the Humber Partnership looks at how across the Humber geography we have a wider range of organisations that work together. And as I'll touch on in a minute, there are certain key pieces of work that we're driving through the Humber Partnership, including looking at how we make sure we've got safe, high quality and sustainable acute services for the future. But all of the partners within the Humber Partnership are really important in making sure that we work in a connected way to deliver better outcomes for our populations. We also are lucky to have really thriving partnerships at place, and we've continued to make real progress in terms of how those partnerships operate. And we work closely with these as well as working with the wider system. And I've mentioned on here just some of the key partners that we work with, but there are others as Fessel identified. But North Lincolnshire Council, our public health colleagues, Healthwatch North Lincolnshire and our local provider partners, including Rotherham, Doncaster and South Humber Trust, Northern Lincolnshire Gould Trust, working with East Midlands Ambulance Service and Safecare, our local GP federation, who are a group of our local GP practices that work to provide an extended range of services, and also critically with our wider voluntary and community sector partners. This just describes how we've come together to join together some of our governance, so that's how we make decisions and how we're accountable within our local place, and how we ultimately account to our Health and Wellbeing Board to make sure that we are delivering improved outcomes and reducing health inequalities across our populations. And we now have within that our Integrated Children's Trust and our Integrated Adults Partnership, where we work closely together with a whole range of partners to make sure that we are delivering what we need for our population. So let me tell you specifically about a piece of work that we are doing across that Humber Partnership, which is the Humber Acute Services Review. Now, the Humber Acute Services Review is about looking at the future configuration of hospital services. And what we've discovered over a number of years is that we do struggle to actually attract the workforce to be able to do all the things that we need to do. And we certainly experienced this within our local hospital services. As a result of increased specialisation, but also how we attract people to our local geography, we find that in certain specialties, we aren't always able to recruit the people we need to do that work as well. So it's really important that we look at how we work broader on a broader geography and broader footprint to be able to support that as well. And we know that as a result of that, patients aren't always seen or treated as quickly as we'd like them to be. And we've now reached a critical point where we make sure that we can continue to have sustainable and safe services in the future, that we work to join that together. We also know that much of our medical equipment is old and doesn't necessarily work as effectively, and we don't have all of the facilities that we'd like to be able to do that. So it's really important that we make sure we attract the resources and support to be able to deliver the world-class services that we want in the future. So the Humber Acute Services Review is about coming up with a clear plan for the future of hospitals that will describe how we provide modern healthcare for the population of the Humber region. Critically, we're doing this through a clinical focus. So we are looking at some of the key fundamental building blocks of hospital-based care. So that's urgent and emergency and acute care, maternity and paediatrics, and planned care. And we're working very closely with our clinical staff to make sure that we design the best services to meet the needs of our population. In addition to this, we want to make some rapid work to make sure that where we do have problems with some of our specialties, because we're struggling to recruit the staff that we need, that we act now to make sure that we can continue to deliver the best services that we can for our population. And I've identified that some of the specialties where we're doing that work, very much clinically driven, to be able to support that. It's critical to us that as we go through this process, we listen to the voice of the public and our population, and that they're really keen making sure that they shape the changes that we're making. So this process is very much driven through clinical and expert groups, but also through our local population. So where we do develop clinical models, that we share those and make sure that we have the opportunity to hear the voice of the public in shaping what those services look like in the future. I'd like to end by talking about some of the success stories that we've had in the CCG. You've heard about the COVID effort and the huge amount of innovation and work that's occurred as well. But as well as that, we've had some great examples of success across our CCG working with our partners. The first one I'd like to mention is the Haven, and this is our late night support for the safety of people with mental health problems. Sometimes people don't necessarily need a mental health professional, but they do need somebody to talk to at a time of crisis. And this was launched in Scunthorpe in January 2020. We've had great use of the service, and particularly through this very challenging period that we've gone through, it's been a really valuable asset across our population. I'd like to also talk about our community response team, which has come forward as a piece of innovation through the COVID period. And this is a GP-led model, which is a full multidisciplinary team that work together to deliver a quick and integrated response to better meet the healthcare needs of our residents, particularly focused on those individuals with chronic complex conditions, with the aim of trying to stop us having to take people into hospital, but support people to stay at home with the right wraparound care. Our integrated musculoskeletal and chronic pain service is a really innovative service where 4 of our local providers have come together to deliver a fully integrated pathway for musculoskeletal care, both from the point of giving advice and support and guidance to people to providing diagnosis and treatment for our patients. And that's working really well to improve the services within North Lincolnshire. I mentioned earlier our primary care networks of GP practices working together, and we've got 4 primary care networks covering our population of North Lincolnshire. And those networks have started to look at recruiting a whole range of new roles to help to support primary care, including roles such as pharmacists and social prescribers. They're also gearing up to look at providing a range of different services as well on top of standard primary care. So things like support into care homes, early diagnosis of cancer, and optimising how people use their medication. As part of a broader piece of work across the whole of the Humber Coast and Vale area, we've also done lots of work with our medicines management team to look at how we reduced waste from medicines by looking at how we manage repeat medications, but also how we support people to access the right medication they require without necessarily needing a prescription as well. So that's really helped people to get good access and reduce wastage of medications. We've seen huge acceleration over the past 6 months around primary care online and video consultations. Because of social distancing requirements, then people have had to look at different ways for how they access care. And the ability to quite rapidly be able to do that via video consultation or via phone call has been really, really helpful. Digital isn't for everybody, so we're still very much looking at how we support people on a face-to-face basis where we need that. But this has been a really valuable source, both to the professionals and to patients within our area. We also introduced a hot clinic as well during the pandemic so that if people were COVID positive, they had somewhere to go where people had the appropriate PPE and were able to support them without coming into our usual healthcare facilities. And then finally, huge digital progress. So to enable us to deliver effective integrated care, we need to make sure we've got the right technology to be able to support that. Every GP practice has access to online and video consultations, which has really been critical through this period. We've also done lots of work with our local care homes to make sure that they're connected into the system and that they can get access to the support they need from health professionals through the same online consultation processes. And we've also used the enhanced shared care records as well, particularly focusing on palliative care coordination, so to enable all professionals to work really closely together to get the best outcomes for people at end of life. And they're just a few examples of many of the great things that we've managed to achieve over the last year. I'd now like to give you the opportunity to enjoy our full highlights of the year video.
Over the past year, North Lincolnshire CCG has been working hard to improve local NHS services. Here's a few of our highlights from this year.
Our country recorded its first cases of coronavirus COVID-19 at the end of January 2020. And 2020 then went on to become the most challenging year in the history of our National Health Service. Unfortunately, we have lost many people to this virus. On behalf of North Lincolnshire CCG, I would like to offer the most sincere condolences to all those who have lost loved ones, and thank every single person who has played a part in our local response. A special thank you to our frontline NHS and care worker staff who have been so dedicated and compassionate throughout. North Lincolnshire has done really well in the battle against COVID-19, and everyone should feel proud.
A great deal of fast-paced collaboration took place between North Lincolnshire partners to address the challenges posed by COVID-19. We know our hospital doctors, nurses, urgent treatment centre GPs, out-of-hours GPs and many others were treating the most poorly in hospital. But out of hospital, there was some really great and innovative work too, between primary, community and social care, as well as other partners. This included an outstanding response from North Lincolnshire General Practice teams.
Now plans are intensifying in our area. Patients being moved out of hospitals to make way for those with COVID-19 and new isolation clinics being set up in North Lincolnshire.
There are strict infection control policies and procedures that need to be adhered to when seeing these patients. We need to have plentiful PPE, personal protective equipment. Sometimes there needs to be a separate entrance for people with suspected coronavirus to come into, a separate exit also.
The hot clinics or isolation clinics, when they were set up, were actually seeing patients face to face, full assessment with proper PPE. So we were seeing these patients with suspected or confirmed COVID after 6:30 in the evening when the normal surgery is shut and nobody's around. We took maximum precautions where the patients used to wait outside before they were called in, and they were led by the clinician straight into the room with a minimal contact with the surroundings.
So the COVID clinic was set up in a very short space of time, making great changes to the way we work to be able to see patients in practice with the correct PPE so that the patient and the staff were all protected.
COVID-19 provided an opportunity to enhance the support provided to our care homes, but also to continue our great work with key partners such as North Lincolnshire Council and Public Health.
Throughout the COVID pandemic, we've received a massive amount of support from the CCG. This has included regular telephone calls ensuring that we're okay for PPE and if we need any ongoing support. CCG have also provided us with all the equipment to enable our residents to have their observations done within the home. This has avoided unnecessary hospital admissions. We've been offered a lot of virtual training, which has included clinical observation training, infection control and numerous other subjects which continue to be delivered. The ongoing support from the CCG has been very, very valuable to care homes.
So in relation to the RPC training, over an 8-week period we were able to train 1,826 of our direct care home staff throughout all of our 59 care homes. The CCG nursing team also provided support visits to any of our care homes where they had residents who had been confirmed positive to COVID. So in addition to this, our colleagues in the local provider development team and the local authority made daily telephone calls to every care home. The CCG also commissioned a community response team with a GP providing 7-day cover for any immediate concerns or actions which were required for residents within the care home.
At the beginning of the pandemic, many healthcare services quickly switched to digital consultations and solutions.
COVID has had a massive impact on all of us and the way that services operate. So it's been really important that digital technology and IT become a supportive enabler. We've introduced new agile ways of working. So we've issued hundreds of laptops to allow clinicians to work from anywhere. 100% of practices now have online consultation facilities and video consultation facilities. We've now had over 7,000 video consultations confirmed. Linked to that, we've had nearly 40,000 text messages sent from our GPs. We've issued connected tablets into care homes and into hospices. Last year we launched humberhealthapps.co.uk, where those patients who have mobile phones or computers or tablets can go and get recommendations on the most appropriate apps for them. We have worked with our 111 service to ensure that primary care appointments can be booked in the right circumstance via 111 directly with your GP.
It's just continuity of care, and I think that's what we've got to be focusing on in this day and age. We've got to be able to work smart, seamlessly within different systems and ensure the fact that we're avoiding duplication. And we're going to need everyone to work together to make this a success. So it's looking quite positive right now.
Alongside the mental health charity Mind, we launched The Haven, an initiative to provide late-night support and safety for people with mental health problems in Scunthorpe.
I work on the Haven project as a lead support worker, which has involved us doing a lot of face-to-face work with people with mental health difficulties, crisis prevention and crisis support, hopefully alleviating some of the pressures on accident emergency, the statutory mental health services. Generally we will meet, we have groups, group activities, peer support sessions, mental health focus sessions, as well as art and craft and other just talking time and company and reducing that isolation for people with mental health problems.
Lung patients in North Lincolnshire were the first in the UK to benefit from a pioneering virtual reality pulmonary rehabilitation programme.
This is a virtual reality headset, but doctors say they could save lives. Lung patients in North Lincolnshire are the first in the UK putting on the goggles to help with their physio. Plus, it cuts down on hospital trips during the current health crisis.
This is the only area currently which is able to provide pulmonary rehab to their patients, because the conventional training had to stop, and that was just because the social distancing, and a lot of these patients need shielding, so they had to be protected.
On the 8th of January, the CCG was the first in the country to kick off celebrations for the Year of the Nurse and Midwife, with a best practice learning event for North Lincolnshire practice nurses.
2020 has been dedicated as the Year of the Nurse and Midwife by the World Health Organisation, celebrating 200 years since Florence Nightingale's birth. It's about celebrating nurses and midwives, giving that opportunity to say thank you.
The event went really well. It was an amazing opportunity for them. They all engaged. There were lots of people there from different practices. It was as if the penny was dropping that actually as a practice nurse they had lots of opportunities.
For more information about your local NHS, please visit www.northlincolnshireccg.nhs.uk.
I'd like to thank all our staff members and partners and all the great work that they've done to help us achieve those successes. I'd now like to hand over to Emma Sainer, our Chief Finance Officer, who's continued to do an excellent job in keeping the money on track. I'll hand over to you, Emma.
Thank you very much, Alex. And I have the enormous pleasure of being able to present the statutory part of the annual general meeting, and that is to go through the financial performance of the organisation for the year 2019-20. I am going to go through quite a bit of the detail in terms of how we've achieved the targets during the financial year. But I also wanted to just give some personal reflections on what matters to me in terms of how we're using that resource and making the best of that for the population that we serve. So in terms of the financial targets, as I say, I have huge pleasure in being able to present our performance to you here this afternoon, and we have been able to achieve all of the targets that were set for us. And I've been in post now working on an interim basis across in North Lincolnshire since November 2017. And I have to say, when I first came here, there was significant financial challenge. We were facing significant deficits within the organisation and within the services that we buy on behalf of the population. And I think it's fair to say that the financial performance and trajectories were going in all the wrong direction. I am really, really pleased to say that we've managed to turn that around, and that isn't absolutely just about me, it's about the wider organisation. I am the Chief Finance Officer of this organisation, but it isn't me who spends the money that we have. And so the performance that I present this afternoon is absolutely down to the wider team effort. I have to say that's also working incredibly hard with our provider and partner organisations across the system. So yeah, a really fantastic achievement. So you can see here described that we have delivered our in-year break-even position, so we've lived within the resources that we had allocated for us. We are also set a running cost target, so that's really an assessment of how we do against a target that is established to make sure we're as efficient as we can be with the management overheads of this organisation. And I'm really pleased to say we've lived within that envelope, and that's less than 1% of our overall resources available to us, which is pretty good going, I think. We're also incredibly proud to say that we pay our bills very efficiently and very, on time, because actually it's really important as a public sector organisation that we are making sure that we flow cash into our providers, including non-NHS providers. I'm particularly passionate about making sure that wherever possible for non-NHS organisations, we make sure that liquidity is provided in as timely fashion as we possibly can. So again, one that I'm really proud of. And in particular, our external auditors have gone through with a fine-tooth comb our annual accounts and our presentation of our finances, and really pleased to say that they found no recommendations for improvement, which is a huge testament to the team. In terms of where our money goes then, a total of just over 279 million spent within North Lincolnshire CCG. Unsurprisingly, the vast majority of that expenditure is with our hospital trusts. So just over 126 million of that going into those organisations. What you will start to see over the coming years, and is starting to change, is a bigger proportion of our expenditure being deployed and used in the out-of-hospital setting, so within primary care, within community services, but also as we start to work, and I'll come on to this in a little bit, as we come on to work more closely with our local authority colleagues, what we are starting to do is blur the boundaries between our services and make sure we're using our resources to best effect. And so you will start to see, as I say, a bigger proportion of our expenditure been allocated into those sectors. That's not to say that our hospital trusts are not hugely important and a significant priority, but we do recognise that primary care and community provision hasn't necessarily been invested into the levels that it maybe should have been in the past, and we want to try and redress that balance in the coming years. You can see there the full sort of reflection of where our resources go. You can see there the expenditure on running costs and ambulance services, I should say. So yeah, quite a helpful and transparent way of describing what we do with our resources. So as I said, what I would like to do is give some personal reflections on what matters to me in the role and job that I do over here in North Lincolnshire. And I have to say I'm a huge advocate for strong control over what we do with our resources. That's not to say that I think cost saving and cost control needs to be micromanaged as such, but I do think that having controls and governance, the way we make decisions in place is hugely important. And I think that's something that as an organisation we have put in place over the last couple of years to make sure we understand where our resources are going, what we're spending our money on, and so that we can understand where we can make improvements if there's an opportunity to do so. I think we have had a process of being able to work with our providers and our population to manage demand, so manage the numbers of patients that are going into particularly our specialist units. And again, that's about just making, it's not about people doing anything wrong, it's just about trying to make sure that we encourage our population and our patients to access the right care at the right time in the most efficient way possible. And as I've said already, I've alluded to this already, our focus is very much about making sure that wherever possible, we increase the proportion of our spend within services that are closer to patients' homes. You've heard from Faisal and Alex already, we have a huge level of inequality across North Lincolnshire. And we are absolutely passionate about making sure we tackle those inequalities. That is going to mean using creative and innovative ways of meeting those differences. And what you can see described here is a real passion and motivation for investment in not only physical health, but our emotional health and well-being of our population too. That's never been more important than the times that we've been through the pandemic that we've seen. And I think certainly going forward, there's a reflection that our financial planning needs to take even more account of that growing need of our population's emotional health and well-being. Primary care, I have to say, I've worked in the NHS a very long time, more than I'd like care to admit. You know, primary care is absolutely the bedrock of the NHS. It's very often the first point of call for any of us when something's going wrong with our health. And I have to say, what Alex and Faisal have described, we have to be able to invest in those types of services going forward if we are going to continue with the improvements that we plan for North Lincolnshire. And I think the development of the primary care networks is going to be critical, and how we make best use of our workforce within the primary care setting, again, is going to be a significant priority. Delivering value for money, you might think that's an obvious thing to say, but it really isn't. And as I've alluded, that isn't about, you know, cost cutting for the sake of cost cutting. It's about genuinely looking across our services and our opportunities for change, and driving every pound of value for money through that. Increasingly, that is not about competition. So within the NHS, we have had a system of competition between providers and the different sectors. I have to say that I think competition has had its time, and I think you'll see through the long-term plan for the NHS a much more emphasis on collaboration than competition. And I think that just enables us as part of the NHS to deliver better value for money with the resources that we've got. In terms of sustainability, it is really important that everything is in equilibrium from a financial sustainability perspective. So regardless of whether it's primary, community, ambulance services or the hospital, we have a responsibility for maintaining the sustainability of the workforce that delivers vital care to our population. In terms of the better use of the North Lincolnshire pound, one of the big areas of focus that we've had in place in recent times is our work with North Lincolnshire Council. A few of us had the absolute pleasure of being part of a committee in common. It was its inaugural meeting this week, which is very much about putting our resources and money together with the local authority to think again very creatively about how we work together to ensure that where services are being delivered, that they are being done so to the most efficient way possible. I'm incredibly excited about that. I think it heralds a really new way of working, and one that will continue in the context of the changes that Alex has outlined. So yeah, we are part of the wider NHS, and we are also a very crucial part of the emerging integrated care system. I am very excited about what the next few years brings. I think we've had an incredibly difficult year. The money has almost been put on the back burner, but I can categorically confirm that we have kept financial governance and control over every pound we've spent, even during these very difficult times. And I think coming out or learning to live with COVID as we are likely to do, it isn't going to take away from the requirements for us to work efficiently and as effectively with our providers as we possibly can. We have got one pot of money within North Lincolnshire. We have one workforce. How we deploy that is going to be crucial in the coming years. In terms of reducing running costs, we always have an eye to how much we cost as an organisation to deliver the duties that we have. But I think we benchmark incredibly well, but with the work that Alex has described around how we work across organisational boundaries, that will only improve in the coming months and years. It's been a fantastic 2.5-3 years time at North Lincolnshire CCG. I am incredibly excited about what the future holds, and I think the money has to continue to be an enabler of change, not a barrier. So thank you for listening to me. as I say, that does conclude the statutory part of the annual general meeting from a financial perspective. And I have great pleasure in introducing you to Dr. Satpal Shekhawat, who you have already seen on the screen as part of the highlight video, but he's going to talk to you a little bit more about the pulmonary rehab. Thank you very much.
Thank you, Emma. If there's anyone who can make numbers more interesting, then that's Emma. So good afternoon, everyone. I hope you're enjoying watching our AGM in comforts of your own households with the help of technology. I'm going to talk about a similar thing, which is that where we've used technology for our advantage to improve service care for our patients. So in North Lincolnshire, we were one of the first in the country to launch a virtual reality pulmonary rehab program at a scale which was for the entire region, catering for a population of over 170,000 patients. The reason we were successful in doing so was with the help and support from NHS England. So in 2019, we were successful in a bid submitted to NHS England, which was to help the patients suffering from chronic obstructive pulmonary disease, or COPD. This was in line with the NHS long-term plan, which is to deliver care closer to patients, making it more accessible and supporting them with self-managing their own conditions. This was launched earlier this year in February 2020, just before we started facing the lockdown and the challenging circumstances with COVID-19. All our GP practices now in North Lincolnshire, which is 19 surgeries, they can offer this service to patients. And that involves them to be given and provided with a kit, which includes a virtual reality headset. And then they can do exercises to improve their breathing capacity. And whilst they're doing it, they are being instructed by a digital instructor. The app, as you're wearing it on your eyes, it's a very immersive app. You feel like you're in a different place. And the person who designed this app basically transports you to a really nice beach where you are joining your other colleagues to do exercise. Now, traditionally, pulmonary rehab and the classes done were always delivered in hospital environments or in leisure centers or other venues, and they were usually led by physiotherapists with input from other specialists like lung specialists, and you would have people from mental health team come and talk to these patients. What this service, the new service which we have launched, has achieved is it's providing us another 501 appointments or pulmonary rehab opportunities for our patients. And this would support the existing service, so that would enable our patients to get this service quicker in a timely manner so that they can avoid getting repeated hospital admissions or flare-ups of their condition where they're not able to look after themselves. So far, the project has been a huge success despite the challenges we faced. So when we launched the service, we didn't envisage COVID-19 would come and stop us from sort of launching this and advertising this and promoting this project. However, it came as a blessing because the traditional methods of pulmonary rehab had to be discontinued, primarily for two reasons. One, that social distancing was important to prevent spread of coronavirus, and also most of the patients who suffer with this condition are either vulnerable or in shielding category, so they needed to be protected and kept away. In terms of where we are now, we've had successful first batch which had completed this program, and they have been discharged back into the community. We've had very positive feedback from patients. There are several anecdotes. I'm just going to use a couple of examples here. So there was one patient who has found that she can now do her household chores without pausing for breath, without stopping. and there's been another gentleman who is now able to dress by himself without requiring assistance. For most of us who are fit and well, this means nothing, but for patients who have been suffering with breathlessness symptoms due to COPD, it means a lot to them. It means dignity to them. It means independence to them. In terms of the face-to-face programs, as I mentioned earlier, they were suspended during the pandemic, and this is where this service has come handy to bridge the gap and help our patients. There is a significant number of patients in COPD cohort which required shielding, but these are the same patients who are more likely to get admitted if they catch this virus or any other lung infection. What the rehab does is it enables their lung volume and capacity to improve, which also has an impact on reduction in number of infections they catch, and also reduces the number of times they would require antibiotics or steroids. In North Lincolnshire, the main advantage of the technology has been that patients have been able to use this in the comfort of their own homes, in their lounge. They can use this program anytime they want, and they are not relying on anyone for lifts or transport to get to the venues where this service can be usually provided. We are now looking forward to starting batch 3. So, as I mentioned earlier, we've got opportunity to help 500 patients a year. We want to maximize this service so that we can help more and more people. There are other areas who have learned from us. They have approached us. We have shared our learning in launching this program. And other CCGs, like, for example, Staffordshire, have just recently launched this. There is interest internationally as well. So there are some areas in America which are trying to replicate this model. And we have been helped positively by positive media coverage on this as well. So,
this is a virtual reality headset, but doctors say they could save lives. Lung patients in North Lincolnshire are the first in the UK putting on the goggles to help with their physio. Plus, it cuts down on hospital trips during the current health crisis. Well, more now from our health correspondent, Vicky Johnson.
It feels like I'm running now.
From entertainment to training and treatment.
Does it feel soothing, reassuring?
The use of virtual reality has really taken off. Now in North Lincolnshire, it's being used to help people with COPD, a serious lung disease. Sandra's been using one of the headsets to exercise at home when she'd usually have been referred to hospital for physio. We filmed her through her window.
Make sure you push down quite firmly into the ground.
It's brilliant. You really get benefits from it. I found my breathing is a bit better than what it was. Like when I'm going up the stairs, I used to have to stop 2 or 3 times.
Sharon is one of the therapists involved in the programme.
Hi, Mrs. Carty. How are you finding it then, Sandra?
My breathing has got quite a bit better than what it was.
Oh, God, that's excellent.
They can access it straight away from their own home, and the benefits that people are reporting back to us, they're not running marathons, so they may spend 10 minutes more in the garden. They may be able to go upstairs a little bit easier. A lot of patients are reporting that they're sleeping well.
Exercise is important in managing the condition. VR means programmes have continued despite the lockdown.
This is the only area currently which is able to provide pulmonary rehab to their patients, because the conventional training had to stop, and that was just because the social distancing, and a lot of these patients need shielding, so they had to be protected.
Research is now going on to assess whether this virtual rehabilitation can reduce the number of infections and hospital admissions among its users. If it does, it's likely to be adopted elsewhere in the country.
Vicky Johnson, great work going on there. We're talking about the...
So I would like to welcome Erica now for our question and answer session. And I would like to thank everyone, all the practices, all the GPs who have done hard work during these challenging times. Thank you, Erica.
Good afternoon, everybody. I'd like to thank our panel for their presentations this afternoon, but their work is not done just yet, as they're going to actually have to answer some questions. So we've had a number of questions from members of the public and stakeholders, so I'll now read out those questions and after each one, welcome one of the panel back to the podium to give the answer. So the first question is from Rick Spinks in Scunthorpe. Thank you for your question, Rick. The NHS has been doing a brilliant job and I want to say thanks, but some of us are struggling to see our GPs face-to-face in Scunthorpe. When will GPs return to their practices, please? And I'm going to ask Faisal to answer this question. Thank you.
Thank you, Erica. Thank you, Rick. Really good question, and I agree the NHS has absolutely been doing a brilliant job. With regards to general practice, it's probably worth providing a little bit of clarification around how things have been operating. Our absolute priority has been to keep people safe. So right at the outset of the pandemic, what was agreed, and this was agreed nationally, was that it wasn't necessarily a wise idea for people to book appointments in the way they have done previously. And we asked people to start ringing or making appointments online. And that was to really prevent amplification of virus transmission within waiting rooms. I appreciate for some people there is no online or telephone access, and we've been working to ensure that that inequality doesn't take place. In terms of GPs being available and being back in practice, general practice has been open throughout, and they've been seeing patients throughout, consulting patients throughout. Yes, they have been operating in a different way. So telephone consultations, video consultations, and online consultations have been predominant during this pandemic. However, there are absolute instances where people clinically need a face-to-face appointment, or for some other reason, they need a face-to-face appointment. And those people are offered face-to-face appointments. They are seen within practice or another location. We have commissioned other services, for example, a COVID isolation clinic, which you've heard about in the community, and that's for suspected or confirmed coronavirus patients. One of our local practices runs a special cold clinic, what they call every single day. And we've got other services we've had running throughout the pandemic. For example, when shielding was in place, we had a shielding GP visiting service. We've had GPs working in the out-of-hours unit, seeing people face-to-face, and in the urgent treatment centre in the hospital. So general practice has actually been working harder than ever throughout the pandemic. Our GPs have been around, they have been seeing patients, they have also been consulting patients in a different way. So I'd like to thank you for your question and reassure you that face-to-face appointments are available. And I'd like to take this opportunity to thank our GPs and all the general practice teams, because it really has been a time of great change for them, and they've stood up to the challenge really, really well. So thank you.
So our next question is, people are waiting to have planned operations. I understand things are getting back to normal after the first COVID wave, but what is the plan for getting services up and running again? And I'm going to ask Alex to answer this.
Hi, thank you for that question. At the height of the pandemic, hospitals were asked to stop non-urgent plans, so that's operations, to enable them to focus their effort around the urgent COVID requirements as well. Hospitals since that point have been starting to increase the amount of planned operations that they've done, but that's been quite challenging because they've had to do that in an environment of social distancing, making sure they were adhering to the infection prevention and control requirements, and also personal and protective equipment. And that does impact on how productive hospitals can be in terms of delivering that. As we've been going through the latest phase of the pandemic, all of our hospitals and other providers have been asked to plan for how they can restore those services, because we have seen an increase in waiting times and waiting lists as a result of this. So there's challenging plans now for all of our providers to make sure that those services are now getting reinstated, but they are very much focusing on those clinical priority areas. So their first priorities are around the urgent services, things like cancer, but also a range of other priority things as well. That does mean that some patients will have to wait longer for their planned operations, and that is going to remain a challenge as we go forward, particularly as you've seen with the increased levels of COVID that we're starting to see as well. As with all adversity, there are opportunities, however, and what we've seen is that this has driven really rapid change in terms of different ways of working and different ways of doing things. So we've seen a lot more things like, for example, outpatient appointments being delivered virtually rather than people having to go into hospital settings to do that. And as colleagues have mentioned, or doing them in a different environment. And that has really been very beneficial in terms of making sure that people can be seen. Just as well to ensure you about clinical quality and safety, all those people who are on waiting lists are continually being reviewed by our hospital providers to make sure that any clinical risks that are associated with that are being managed effectively as well. So that does provide some reassurance. It's going to continue to be a challenging time, but again, we've got really firm plans in place with our providers to make sure that we're able to support that.
Okay, our third question is, a recent report said depression among adults has doubled since the start of lockdown. I am concerned about what mental health services are out there to help people cope. What are the CCG's plans for this? And again, I'm going to ask Faisal to answer this.
Hello again. Thank you for the question. So parity of esteem is giving equality to mental health and physical health. And that's been a top priority for our CCG for a few years now. And it's become an increasingly strong priority now because of the increased depression we're seeing and anxiety we're seeing during this time of COVID and some of the post-traumatic stress disorder we're seeing. So in terms of services that are available for patients, we have many services in North Lincolnshire. Our GPs are always a point of call, or the wider general practice team. We have the IAPT Talking Shop service in Market Hill that offer counselling and other types of cognitive behavioural support. We have the Haven running for some of the less urgent mental health support, and that runs most evenings and on the weekends. We have our Ardash community mental health provider team who do a great job and provide a plethora of services. For some of our young people, we have a new online service called Kooth that they can go online, and the feedback we've had regarding that has been that it's been really helpful because we know many of our younger population like to access services online. And there are many other services. So the first thing I'd really like to emphasise is that this is a top priority for our CCG. We need to invest more in mental health. We need to make sure services are accessible for people. And I think the question really raises an important point for the CCG, which is people should clearly know which services are available and how to contact them. And I'm going to take an action away from here and see if maybe we can do a piece of work to really clearly delineate for our public, for our population, for our patients, which services are available and how they access them. So I hope that answers the question. Thank you.
Our next question is around COVID. I am worried about a second coronavirus wave in the winter. How likely is it that this could happen? And I'm going to ask Satpal to answer that question.
Thank you, Erica. So as Faisal spoke in the beginning of his talk, and he shared the numbers of cases we are seeing in our region, we are all seeing an increase, and these anxieties are shared by all of us. I think there are several things which we have learned, and if we reflect on how did we tackle this in the beginning, it's quite important that we all work together to keep the numbers down, and that's quite important to help our region and our population. So in terms of what we can do, frequent hand washing, social distancing, avoiding unnecessary visits to supermarkets, sitting in a well-ventilated room, and those are simple measures which will reduce the transmission of the disease. Flu vaccination is going to be an important part in this. And again, the GP surgeries have started their flu vaccine campaign. So people who are eligible for flu vaccination, anyone who's over 65 or have a long-term condition, or if they are family members of shielding patients, they can book appointment with the GPs and get the vaccination done. Again, these will help preventing other infections which might take up resources which we would require from our hospitals. This morning, there's been launch of the NHS tracing app. Again, if we utilize that, it would reduce and help reducing in transmission of viruses, which again will play an important role in keeping the numbers down. In terms of health system, we are in a much better place. We know what works. We know what the shortcomings and challenges were. We are in a better position with PPE and understanding. And as a CCG, we have got services running, which Alex talked about earlier, which is our isolation clinics, our community response team. So those services will give us a head start to tackle this challenge. Thank you.
Okay, this is a similar question. We hear about the threat of winter, and if there is a second wave of coronavirus with it, what is the CCG doing to plan for a second wave? And I'm going to ask Alex to answer this question. Thank you.
Thank you, and thank you for the question. Every year at this time we work very closely with our partners to plan for the pressures of winter, and this year we have a unique challenge of trying to manage the increased activity and admissions that we see over winter alongside the COVID pandemic. We've continued to work really closely with our partners to understand how we can help to support this as well. And this includes working with our hospitals to make sure that they've got the right capacity to be able to keep us safe through the winter period. But it's also really important that we look outside of hospital as well. So before people need hospital support, often people can get the care and support that they need in other places. And again, I'd just like to encourage people to use facilities like NHS 111 First, because that can help to direct you to the right services that you need, which may not necessarily be hospital services, but can be met in another area as well. And that helps us to keep the services in hospital to the people who really, really need them. We also work very closely with our hospital partners so that they've got good facilities within the hospital, A&Es and emergency departments to be able to rapidly assess and support people and provide the right care for people. And then critically, making sure that when our people are well enough to go back either to their own home or another facility, that they can be discharged swiftly and effectively, working with our partners in social care. I would just like to take this opportunity as well, just to remind people who are eligible to access the flu vaccine as well. It's really important this year with the added pressures that people do access the flu vaccine so that we can manage our usual levels of circulating influenza as well. So please do make sure that you are doing all of those things to help to protect yourself through the winter period. Thank you.
And our final question was, I was reluctant to send my children back to school because of the virus. Should I be worried? And I'm going to ask Satpal to answer this question. Thank you.
Thank you, Erica. I think firstly I would like to say, every member of our panel today who's been taking part in the AGM is a parent. So we understand this question and we understand the concerns every parent has. It's also very important to thank our North Lincolnshire schools and their staff who have worked through the summer to make sure that the premises are COVID secure when they receive the children. In terms of how we can make it safe for our children, there are two aspects. So the first one is that we need to keep reminding our children and educating them about steps they can take to reduce transmission of this infection. And in my own personal experience, children are very good in remembering. My own son still sings happy birthday twice when he's washing his hands, even if I forget. And this is a good example because once they're told and the teachers remind them, they'll stick by rules. And I've seen that when my kids have gone back to school, that they're sticking to one direction of flow, they are sticking to their bubbles. But keep reminding them of the message, making sure they have hand sanitizers to sanitize their hands, making sure that they are taking all the precautions of the distancing is important as parents to keep guiding our children to do the right thing. And the second aspect is about reassurance from the evidence we've got so far. So national and international studies have shown that children are very unlikely to catch this virus, and even if they do, they will get a very minor form of this illness. So they're not severely affected by this, and that is the reason why the Chief Medical Officer has guided the government to keep the schools open. So I hope that these answers provide you some assurance. Thank you.
Okay, that is the end of our question and answer session from those that were sent to the panel. I just want to thank all the panel members for their open and honest answers. If you want to ask any further questions following this afternoon's event, then please email them to nlccg.news@nhs.net, or you can ring on 01652 25 1000, or go to our website and then you can actually just go from there on to being able to communicate and contact us. So I would actually now just finally like to hand over to Dr. Fesselbeg to close this year's meeting. Thank you.
Thank you very much to our Vice Chair, Erica, for hosting the question and answer session. Thank you to everyone who's joined us today. I'd like to apologise again for some of the IT difficulties we had. We got there in the end. And I'd really just like to finish by saying thank you to everyone who supported our CCG as an organisation. Thank you to everyone who supported the local NHS, who's worked in the local NHS. It's clear we have lots of challenges ahead. I can promise you, as an organisation, we will continue to do our very best for the population of North Lincolnshire. And I will say to you, please carry on supporting us. Let's work together, and hopefully we'll get the best possible outcomes for our population. Thank you so much.